Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VACHA. I'm Tracy Douglas Vacha's Chief Executive Officer. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. Good day, everyone, and thank you so much for joining Common Health again. And today we have a fantastic guest here, and that is Tam Nguyen.
Yes.
Am I pronouncing that correct?
Tam Nguyen or just Tam Nguyen?
Okay. Yeah. All right. Tam, I am so glad you decided to come and join us today and talk a little bit about dental services here in the Commonwealth of Virginia, but also talk a little bit about who you are, as well as an article, an opinion actually that you had wrote to the Richmond Times-Dispatch. And we'll get to that article in a little bit. But before we get there, I want you to just tell our audience a little bit about who you are.
To kind of tell you guys a little bit about myself, I am a first generation Vietnamese student. I don't even know if first generation would be the word because my mom and I came over here as kind of refugees. So I think first generation technically is like will be my kid. I come from a very low socioeconomic family who, honestly, I didn't believe I could get here. And it was a very, very insightful journey that I went on, and I'm still on. And I'm very grateful for every day of it, just because I think I've become so much better as a human being from going through the ups and the downs of just life. I think if I had gotten in earlier, straight out of undergrad, I don't think I would be, I honestly don't think I would be the type of person I am now. I honestly hated going to the dentist. I did not have a good time. I loathed it because every time I went, it was a lot of just discomfort and pain. And I never really understood why we had to go other than cavities, right? But as a child, it honestly sucked.
Yeah.
Yeah. So kind of a little background about myself and why I think I started to hate dentistry is my mom taught me how to brush my teeth, and how she brushed her teeth was she always I don't know if it was bad gag reflexes, but she always brushed her teeth and she always gagged on the toothbrush. I don't know who taught her to brush her teeth. So now as a child, what you learn from your parent is, okay, you have to brush, and you have to brush so hard or so vigorously that you're gagging on the toothbrush. You can imagine why I hated brushing my teeth.
Yes.
So I actively avoided brushing my teeth just because I didn't like that feeling. And I had never understood why oral hygiene was important. It wasn't really discussed. It was just, just do it.
Right.
And, as a child, not understanding that, I avoided that a lot. And unfortunately, I grew up with pretty bad teeth. And that's why the trip to the dentist was always so unpleasant, because I always had cavities or stuff that needed to be worked on.
So let me just back you up for just a few minutes here. Mm-hmm. How old were you when you came over to this country?
I came over when I was about 1. But The thing is, I learned Vietnamese first, and it was essentially, I grew up in ESL classes until like throughout elementary school and middle school.
So were you going to the dentist in elementary school? Is that kind of some of your vivid, recollections of those first dentist visits, and it was just really traumatic for you?
Yes, it was definitely very traumatic. I definitely had vivid memories, just because I remember us not, my mom did not know English very well. So a lot of times it would be through family members or just going through offices that spoke Vietnamese. The thing is, it is extremely hard for pediatric patients to sit in the chair sometimes for general dentists to perform procedures. And I recall one time going to the dentist, and I guess I was putting on a fit because I was just in a lot of pain. So they took x-rays and I actually needed to get a tooth removed. Mm-hmm. And I was referred to a specialist. I don't remember exactly if it was a oral surgeon or if it was a pediatric dentist. I don't remember which it was. Mm-hmm. I remember the tooth being extracted incorrectly, meaning I had to get a tooth extracted from, I don't remember if the left or right side, but I remember being in the chair and holding on to the other side that didn't hurt. And I think in the assistant's eyes and in the doctor's eyes, I was touching the one that was hurting. I don't know where the miscommunication was, either in the referral or whatever it was. I remember walking out of there with still a tooth that was bothering me. So that was something I remembered early on in the world of dentistry that made me not want to be a willing participant in going.
So how did your mother even think to take you to the dentist? Were you complaining of a toothache or?
Yeah, I was complaining that there was something going on that really bothered me. And she was like, okay, let's go to the dentist. And, one thing led to another. Like, obviously, as a child, I had already not enjoyed going to the dentist. So now it's like having problems and something hurting and then having someone probe it, which is, extremely discomforting. So that just snowballed. And then again, I don't know where the miscommunication was, but that was one of the reasons why I was very adamantly against going to the dentist and like taking care of my oral hygiene, which again is not the way it should be, knowing what I know now.
Was your mother going to the dentist?
She, I believe she was. I wasn't very aware of her, I guess, recall schedule, and how often she was going, because I didn't really know much as a child. But I do know that she was going to the dentist. And interesting enough, I mean, we have statistics now where, kids will be more at high risk. We categorize the risk level for cavities, or we call caries. It's a higher risk if the mother or the caregiver has had a cavity within the last year. It moves them. It changes categories depending on how often and the last time the caregiver had caries, which is really interesting to me. But if it was categorized like that, there must have been some kind of statistics on it that had the association for them to be like, okay, the child under 14 probably has a higher risk of having caries if their provider had caries in the last however month.
So one of the things that we know, mm-hmm. and I'm going to talk a little bit about the organization that I represent and our constituencies. But before I get there, one of the things that we like to always be aware of is what corners of the state or the U.S. do we see the most problematic when it comes to caries or, any kind of issues around diabetes or right. high blood pressure and things like that. And so one of the things that you spoke about, I thought was interesting in your article, was where you're from, mm-hmm. right? You're from a very rural part of the state of Virginia. And when you talk about all the issues that you had with your mouth as a child, did you find that a lot of children or friends your age, were they having some of the same issues or were that you were aware of? Does anything stand out with you as far as where you're from and knowing some of the challenges and trauma that you experienced going to the dentist? Were you finding that that was happening with some of your friends?
So unfortunately, I don't recall any of those moments with my friends, mainly because um, teeth to me was something that I obviously disliked a lot. So I didn't find it fun to talk about with friends. Um, I don't think I recall a moment when I did talk to my friends about teeth or anything of that sort. I do know coming back here. So I do know that a lot of people in my hometown have higher risk of caries just because of it's mainly more emphasis on the lack of education on oral hygiene, just because it's not really taught in where I was from in school. It's mainly on the dentists and the hygienists wherever they're going to provide that information. And I remember the practice I was going to, it was a high volume practice. So there wasn't really much time for patient education. And now you're factoring in someone who doesn't speak English very well. My mom, she doesn't speak English very well. So, there can be all the pamphlets in the world, and it could be in Vietnamese or in other languages, but you're asking someone with, one or two jobs and that background to, read these pamphlets, and they barely understand English. So now to put in the dental terminology, which is a jargon that, that they don't understand, it's difficult. And I'm learning more about it right now. I think we're trying to definitely change a lot of things. Richmond, I think VCU is very lucky to be part of the Children's Hospital. We just moved into the Children's Hospital. The pediatric residency just moved into the Children's Hospital actually in January of this year, January of 2022, or it was like last year. It's very recent, I'll tell you that. So I want to say it was definitely after COVID that they had moved in. So it's a very new building. We've been in there within about a year. And I give tours a lot to prospective students. And that's something I've always been very proud of, because whenever we're in there, we always see, just adorable kids.
Right.
And we know that we're taking care of patient pools who are very unfortunate, because it's almost the same patients that I see every time I give a tour to the prospective students. It's generally children who are minorities,
Mm-hmm.
right? And I feel very fortunate that I'm in a school that we're able to provide to these communities. I am very proud of VCU for having such a diverse student population, because we do have students who are able to speak different languages and help translate when needed, because it is very hard for families to do this, right? A lot of times it's kind of blindly trusting that the provider in healthcare is doing their job in helping and doing what they can. But like I stated earlier, I had a little hiccup in my dental experience where we don't know where the miscommunication happened. We don't know where the hiccup happened. So I'm not going to assume anything, but there was a hiccup and it wasn't communicated, I don't think properly, to my mother, to myself. And that to me is very unfortunate, because it's going to the dentist is like going to an auto shop, right? You kind of have to trust that the mechanic is giving you the right diagnosis, because you don't know any better. And now you're talking about teeth. Teeth is biological. It's part of your body. So it affects more than just your mouth. It affects your oral health and affects your overall health. And it affects so much more than just teeth, because the teeth, the bones, the muscles are connected. So a problem there could be very systematic that I don't think not a lot of people are aware of. And it sounds very like, oh, like anatomy lesson, like no one really wants to learn about that, right? But kind of like similar with cars, you don't really go to the mechanic until you have a problem. Most people don't go to the dentist until they have a problem. But by the time you have a problem, it's already in a bad state. What we've learned is the signs always precede the symptoms. So you'll always see it before it starts really acting up. And the symptoms and signs are usually always progressive.
So that's the piece that I want to hone in on. So what I'm hearing from you, okay, is that we need to be able to get to individuals before, right? Before it gets to a point where it's can become such a dramatic experience for that child or even that adult, right? And going back to where you're from, right? From very rural part of Virginia, I think it gets down to a trust factor.
Yes.
Okay. How do we get our providers, our legislators interested in thinking about beyond just being in an urban setting or where they're actually, how do we get folks to understand that it takes more than just saying you need to go to the dentist every 6 months? Because we do have that trust factor that goes on there in the communities. And the other thing is that we have learned that a lot of folks in our rural communities have gone without for so long when it comes to their health care, whether it's on the medical side, behavioral side, whether there's an addiction, whether there's a dental issue, right? That they've gone on for so long, what's another, right? What's another 6 months? So how do your mother saw her child being in pain and said, I've got to get you to a dentist.
Right.
But you were in pain. So what would you say to your mom today to say, let's don't wait until there's that pain?
Right. Do you want me to just answer that single question right now of what I would tell my mom? As a dental student now, knowing what I know, and I'm pretty sure I'm going to be saying this as a practicing dentist, excuse me. The risk of caries has decreased so much since discovering that fluoride has benefits for the enamel, right? So the caries rate has gone down significantly, and now I believe that the focus should be on preventative care. And preventive care is something that is kind of covered in Medicaid. It definitely could be better. And that's why I think it's important for myself and other students to be proactive in that. So recently, as a D1, we were introduced to Lobby Day, which is when a bunch of dentists would kind of meet and then we would go talk to our legislator, which I had no idea until an upperclassman kind of talked to our class about it. And at first, I didn't think it really got a lot of traction because people have exams, people have, things to worry about. So legislation is not something that is the most attractive thing, right? What the upperclassmen told me was, it has a huge impact on how laws are put in place, and there could be a chance for a lot of reform. So I encourage a lot of my classmates to go to Lobby Day and just get reception to meet a lot of the dentists that will be going. And I was very fortunate to see that our D1 class had probably one of the higher turnout rates in terms of the class showing. And that's huge because you want to engage the incoming class, so they could learn as they go throughout dental school, because it will affect them. The thing about that is knowing what I know now, experiencing lobby day, I'm going to strongly push for it as well, just because I've seen. So before I came in and matriculated last fall, I was also working in the dental school the year before. And what I've seen from students graduating is almost attrition from dental school. Dental school is very time consuming. It's very taxing. It's very mentally taxing. So a lot of times you don't want to not put up with, but you don't want to, okay, now having to kind of take time out of your day to go to this lobby day, and instead of having that break day that a lot of them need.
So what was the message on the lobby day? What is it
right.
why did you want the students to be so active in lobby day?
Right. So there were two reforms that we were fighting for very strongly this year. And these two reforms came very near and dear to my heart. I actually didn't know too much about it until I met with the dentist that I was going to work with. So during lobby day, the dental students are paired up with dentists who are from around their region. So then they can go to their legislator and talk to their legislators about the reforms that they want to be put in place. These two reforms were, I'm paraphrasing here, but basically to increase Medicaid benefits. So the first one was to, I believe, increase the age for anesthesia. So I think the age that they had in place was age 8. This I don't know for sure, but I want to say it was age 8 that was the cap for the dental anesthesia in the Medicaid, and they wanted to expand that to age 10. Is what I remember from that. So it's 2 years, but that's huge. So for me, kind of stepping back and taking a look at that, I think that was very appropriate to ask for the benefit to cover up to age 10, because 10-year-olds are in elementary school still. So we're asking to extend the coverage because, kind of what I told you, I was very traumatized going to the dentist. So being able to put pediatric patients under anesthesia, it would probably ease them up a little bit more. It would allow them to be more comfortable in the chair, and having that covered for the dentist, I think, is very important, because now that we are able to meet at a medium where the patient isn't having a bad experience in the chair, and the provider is compensated for the amount of care he or she are giving to the patient.
So Tam, I know that the second reform, and if I can remember reading in your article, you had spoke about was this growing funding cap for the dental Medicaid program here in the state of Virginia. And really, what I would say to you is, yes, there seems to be a lot of attention around being able to continue to fund the dental coverage, because, the state was covering children and then recently made the decision to expand to cover some of the same dental services for adults. Mm-hmm. And if I can recall, since that component of the expansion in the state went into effect, we have had many Virginians actually take advantage of that expansion. I think one of the bigger issues, though, is the fact that we don't have a large number of dentists, right, that want to participate with the Medicaid program, because the reimbursement is
Right.
so low for dentists.
Right.
And so I think that's where the funding cap, if we can get, if legislation can push through to allow for an enhancement in that rate, it will increase, right?
Yes.
The number of dentists that would want to participate and see
Right.
all these adult Virginians, right? So, going back to your story, you highlighted in your article how you felt fortunate when you look back at your experience, right, for dental services and how traumatic it is. And it's so interesting how you're using your experience as a child to direct you where you want to go professionally. And we'll get to that. I want to talk a little bit and explore that a little bit more. But I also want to say to you that, and one of the things that I took away from your article is that you are thankful and grateful that you had the Medicaid, right, to cover the cost of care, because stepping back and looking at what you went through and all the amount of attention, right, and work that dentist did on your mouth, clearly, based off of, your background, it doesn't sound like your mom would have been able to afford those services. So in your article, tell me what your thoughts would be if we lost that coverage.
Lost coverage to just
to be able to provide through Medicaid dental to cover dental services.
Speaking just on my experience first, and then I'll more speak on what I've seen as a provider now, or on the provider side. So just from my experience first as the patient, right? If I was not have the coverage as I was growing up, I think it would honestly, one, I wouldn't be in this field, to be honest. And two, I don't think I'd be the same person. So a little background into this. I grew up in a very, I want to say every family has its own problems, right? Everyone thinks they're from a very dysfunctional family. I honestly believe I was coming from a very dysfunctional family. So my grandpa sponsored a lot of his kids over here. He had 13 kids, and we're a Catholic family.
And your mom's one of those 13.
Yes.
Okay.
Yes. So I'm sure it was very hard for them, escaping the country, trying to get to the U.S. to, live that American dream and have better for their kids. As he came over here, I'm sure it was very hard for him and his family as well. There was a gap of at least 10 years where they were not all together. He was over here first, and then it took time for him to sponsor them over. And as I grew up, I didn't realize how dysfunctional the family was, but I think it just comes with the territory of the lower socioeconomic that is not talked about a lot. I don't know what was going on with his mental health at the time, but I do remember growing up, and at this time I thought it was just a beverage, right? But now, knowing what I know as an adult, he was definitely an alcoholic. He drank every day, and I think he, it was a different culture back then, and with him being in Vietnam as well, he had a lot of daughters. So in, I guess, the Vietnamese culture, it was very, the father figure would kind of tell the daughters what to do. And usually a lot of times it would be like an arranged marriage kind of thing. So it was just very unfortunate to kind of have seen that or witnessed that growing up as a child. I didn't know too much about it. I was just kind of taught you're to do as you're told kind of thing. And for me, it was very hard. I I didn't have a father figure growing up. I actually don't. I've never met my dad. So for me, it was very difficult to kind of understand all that. And I was very shy. I definitely was extremely shy. I didn't really push the envelope on anything. To me, it was just fall in line and do what you're told. And I was unfortunately pre-diabetic, pre-hypertensive, just a little nugget. Right. And
Right.
it was bad.
So if you didn't have this Medicaid
Yeah,
back
it
then,
would have been systemic. I think it wouldn't just have been teeth problems. I think it would have been, you know, I was on the track of I was pre-diabetic. So if I became diabetic and hypertensive, I think that would have contributed to worse dental care. And then that just systemically, that would have been bad for my overall health, not just my teeth.
Okay.
Yeah.
All right. So if you didn't have the Medicaid, right, then you would not have had the frequency of being touched by a dentist.
Right. So in my article, I kind of spoke about, here's the connecting dot here. So, fortunately, unfortunately, I lived in the basement with my mom and brother and some family members growing up. One night, the basement flooded for whatever reason. So, very lucky for us, we moved out of our grandpa's place and we moved in with some other family members, which was probably the best decision that could have happened, right? Just by the chance of the flood happening. Moving away from him, I think decreased the toxicity a little bit and allowed me to be mentored by my best friend's dad, who was a Marine vet. And he kind of was that father figure for me in high school and kind of instilled that if you want something, go get it. You need to kind of just be your own man and not be afraid to. So that's when I started running cross country. I started to better myself. I was no longer pre-diabetic or pre-hypertensive. And this is where it connects with dentistry. I was in a state of still being very embarrassed from smiling because, again, I didn't take care of my teeth very well. So I had a lot of crowding in the front, meaning that the teeth were just kind of smushed together. So I needed orthodontic work. Not a lot of dentists likes to take patient on with Medicaid that needs that procedure because it is an expensive procedure. So we were fortunate enough to find a provider who did. However, they were an hour and a half away, depending on traffic, and sometimes it could be longer. So I was very lucky that my mom was willing to take a day off, which was pretty hard for her to do because of what her profession is. So sometimes we would drive really early in the morning to make that dental appointment. She would drive me back to school and then she would go to work. Or sometimes we would be lucky enough to stay with a family member who is near to that location. So then we can go in the morning and then she could drop me off to school and go back to work. So again, without the Medicaid program, I don't think I'd be able to get the orthodontic treatment done. I don't think I would pursue this field because of the lack of confidence I would have in myself. And just how I am as a person, just from my upbringing, very shy individual. And one now, someone who before couldn't smile and laugh out covering their mouth because they were so embarrassed, to now someone who is feeling a little bit better about themselves because they were given that treatment to help them. And to be honest, it didn't help me with just my confidence in smiling. It helped me a lot with speaking. So I had a slight lisp, and that came from the crowding and the teeth position. So that helped me so much in life that I know that imagine going through your teen years being like that, right? I don't want anyone to go through that because it was very hard for me. So without the Medicaid program, I think it would have just not just in my health, but like my overall life, how I would have viewed the world, because I think I would be a bitter person from having bad teeth. I think I would just kind of blame everything on the system and not getting help, where like, it's not fair. I wasn't born into this family or born into wealth or whatever it is. Right. But through programs like that, I'm very grateful that it was able to change my life. And again, it just stemmed from a flood that happened that allowed us to move out, and then being very fortunate to receive Medicaid and dentists who were willing to participate with Medicaid.
Was this the dentist that you were going to throughout the years? Was this a private practitioner dentist, or was this dentist affiliated with a health system or anything? Or do you remember?
I don't know, just because I received the treatment earlier on, where I was not as cognitive of the dental field, so I didn't really think too much about it. It was afterwards, the final result, that allowed me to appreciate it better. So I remember, what I do remember about braces is it was during high school, and a lot of people had braces. So a lot of times my friends and I would talk about going to the orthodontist and getting new brackets and new colors, because that was the cool thing in high school, right? They would always complain about how it hurts because the new wires would be very tightening. For me, it was very similar to cross country, where the kind of the discomfort and the pain was no longer associated with not brushing my teeth. It was now associated with progress, of knowing that this discomfort is allowing my body to have a better smile. So I no longer took that discomfort from going to the dentist as a negative thing. I took it as, this isn't helping me. And it really changed my view on dentistry. And that's why I am now in dental school. Without having a provider that accepted Medicaid and did the treatment on me, I really don't think I would be able to now be in this field, chase something that I didn't think was possible for myself, because I thought the dental medical field was an esoteric field where you had to be a 4.0 student, volunteer to like mission trips in foreign countries, have a perfect 90 percentile entrance exam, and research rocket science or something like that. I thought it was the upper echelon that became these esteemed professionals, right? And I soon realized that you just have to really want to help others. And I know that's cliche, but with that mindset, you're able to withstand long days in clinic, long days in lab, long days in classes, studying late nights. You think of the patients that you could be affecting. You think of the communities you could be serving. And to me, another thing is just being able to take care of my mom in the future is really important to me. So I think the dental field is a field that is allowing me to do all that. And I really hope that Medicaid will expand to more coverage, just because the more coverage that is allowed, I think the more providers they will attract, mainly because the stigma that was there before, because the coverage hasn't changed in years, and it has really steered away dentists who want to participate because of what they've heard from existing dentists. So I think what we're doing now is very important. I think it affects more than just teeth. A lot of times coverage to orthodontics, it would be considered as cosmetic.
Right.
But I think knowing what I know now, it's so much more than that.
Right.
And
right.
I think dentists and dental students should really participate in stuff like Lobby Day, because we don't know what we don't know.
Right.
And I don't think many dental students are aware of the reform they could have, because we are distracted by other things, distracted by a lot of schoolwork,
right.
a lot of clinical work that needs to be done.
Right.
And people don't realize this, but a reason why they don't want to take on the high, quote unquote, high volume from what they've heard about Medicaid practicing practices. I don't know if it's still high volume, but I've heard it's better. My point from this is they've heard of all that. So now, as you're a graduated dentist, imagine being in a world of debt which was never seen to previous generations. That, along with a lower reimbursement rate compared to insurance, depending on the place, obviously, I think the practice matters too. But if we could overall increase that, it would be better for not just the patients, but for the providers, because no one really thinks of the provider's mental health, right? And that is something that I have seen with my classmates. We work very hard to be in this field. We work hard to help others, and a lot of times the dental field would have this stereotype as a very comfy, financially free job. Maybe that was the case decades ago, but with the amount of debt coming out now, my classmates and I will average at least $300,000 in debt. I know from my debt that I have accrued, I will accrue at least 380, if not 400,000, going out to practice. So now, if you were to present just students that doesn't have my background, who don't have the rural background attached to them, now they get the offer to participate in Medicaid and get less salary versus going to either a private practice or a corporate office who offers them way more so they could pay for their loans and do what they need to do, pay for their loans, say they want to start a practice or whatever it is. It is a point of contingent, because now you have to worry about your debt and your family, and then your mental health. How much do you have to work in order to pay that debt off?
So let me ask you something. Are you familiar with federally qualified community health centers, FQHCs?
I don't.
Okay. So my organization that is producing this podcast is an organization that has a membership made up of federally qualified health centers. FQHCs is what we call them. Also lookalikes. And their mission is to provide care to anybody, no matter what their ability to pay is. Mm-hmm. And those health centers provide a multitude of services. They provide primary care services, they provide women's services, they provide pediatric services, mental health, substance abuse, and dental services. And many of these community health centers are located in areas where you're from, right? So, for example, in the Commonwealth of Virginia, we have 27 community health centers with 182 locations throughout the state. Is that enough? No, we still need to get more community health centers here. But the point being is that individuals such as yourself, right, who has a commitment to this particular population, right, who comes from the rural community, right, who I believe you want to go back to the community once you get your degree and licensure. Well, you can come and work at a community health center. Mm-hmm. You speak about the debt, right?
Yes.
That you have to carry. And yeah, you're right. It's a area that I think we have to pay more attention to.
Yes.
But at the end of the day, if you work at a community health center, there are programs that actually help support you in paying off your debt. You do have to make a commitment back to the community health center, but you won't be working for them, unless you want to, but you do have to make a commitment back to that health center. It's not just about the health center, it really is about that commitment to the community. Mm-hmm. you will see community health centers in so many areas in this country that it's hard to get to. Mm-hmm. So remember, you spoke about how you had to travel an hour out, right? That's one of the nice things about working at a FQHC is that we're located in areas that, communities, individuals in certain communities don't have to commute so far away. So I say that to say to you that, as you continue in your quest to be a dentist, right? Our hope is that you will continue to do these op-eds, right? Continue to push yourself as well as your peers to speak with your legislators, right? Yeah. To continue to support, right? Community health centers, your individuals such as yourself, so that we can make sure we tap into, individuals that we know lives will be, more enhanced, if you will, based off of being able to feel good, right, about their health care, and they don't have, there's no pain in their mouth, right? At the end of the day, what would be your overall message, right, to folks such as yourself, or to that kid that was in elementary school that's got this pain in his or her mouth, right? And knowing where they end up today in dental school, what would be that message that you would say to that person right there about dental care?
Personally, to my younger self, or to another individual who
to your younger self?
I honestly would say the same thing that I've heard a lot about, or a lot of, as I was, struggling to get into school, to keep on keeping on. I've watched when I was struggling to get into school, because I didn't think I'd be able to get in. I'd watch a lot of self-help motivational talks, and one of my favorite was Denzel Washington, right? His saying was always, if you're around the barbershop long enough, you'll get a haircut. The bus leaves the station every 10 minutes. Every day is a new day. So, if you fail one day, this is actually from Kobe. He doesn't believe in failures, because failure is a state of mind, and failure is only when you fail and you don't learn from it and you don't get up. He doesn't believe in failure because he'll always learn from his mistakes. He says failure doesn't exist. Find out what you did wrong and fix it. There's no failures. So if I could hear that, I think that would have kept me going, and I would have pursued dentistry and been more on the track earlier. And I probably would have gone into dental school earlier. But like I told you earlier in the podcast, I don't think I'd be the human being I am today without my lows. And I appreciate it, because you don't appreciate the highs without going through the lows.
Okay, great. Thank you, Tam. Really appreciate you coming in and speaking to us and to the folks out here to learn about how really programs such as Medicaid can really make a difference in a child's life, right? I heard that, from you were saying that, you were in this tremendous amount of pain, and you were very grateful that you had the access that you did, and that it really did make a difference in how successful you were going to be in school, right? But it also gave you the opportunity to learn more about you and where you want to go in your journey, right, through this life. So, keep doing what you're doing and keep making a difference. And don't give up that story, because that story is a very important story for the next Tam that's out there, but also for the people that are making the decisions about whether we're going to have Medicaid and whether we're going to have dental services, right? And finally, think about federally qualified health centers, because I think you will be able to fulfill your dream of being able to touch individuals that might not have that access, right? And you'll be able to do that through an FQHC that does provide dental services.
Gotcha.
All right?
Thank you.
So thank you. I want to thank my guests for joining us today, and thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas. Thanks again, and I'll see you next time.